So facelifts. What is a facelift? Who needs a facelift? Really, facelifts, what they mainly can help is the area of the jowl, which tends to become more square with time as we age, as the tissues kind of deflate and come down a little bit. And also the neck. It gets a lot of help in the neck area, which tends to kind of sag a little bit. Maybe even in some people, they have these two lines here called platysma bands. You can help that with a facelift. And a lot of the fullness gets lost in the mid-face, and so that when we're younger, our face looks more heart-shaped. And as we age, the face becomes more square. And so the idea is to bring the tissues back up and restore the volume and replace those areas with a facelift to bring back that more youthful. And many people look at it more like, I just don't want this stuff sagging anymore. I don't like this squareness and this fullness in this area here. And that's really what can help. And so what does it do? Really, we hide the incisions frequently sort of along the ear crease, the sideburn, along the hairline back here, depending on how much extra sort of things you have there determines how long the incision needs to be to tailor it just nicely, and then kind of lift that stuff up and back and get everything in a nice position. The muscles are repositioned, and then the skin is repositioned in a different direction, so we can get a very natural look. People say they don't really want to look like that wind-blown look, like everybody can't stand Joan Rivers' face. Nothing against her, but people don't want to look wind-blown. And so for me, it's so much more important that you look natural, and people aren't going to look at you and say, hey, well, what happened? And much better people kind of look at you and say, wow, you look good. Were you on vacation? That sort of thing. So for that procedure, people do need to take some time off if you want to be private about it. Like probably after a few days, 3 days or so, you would be able to drive and do office work and that sort of thing. But there are some stitches and also a couple of soft drains that stay in usually for about 4 days for that. And then come out in the office. So many people would take sort of like a full work week, like, you know, the weekend work week and the next weekend off to kind of recover from that one. Most people don't, but you may get some bruising. If you did, that might take a week or so to go away. We do give some medicines to help make that go away faster. And then that's kind of how that goes. As far as activity from that one, you do need to kind of take it easy, especially I generally recommend the first couple of weeks not to do any exercising at all, and then sort of do some light exercise, kind of gradually increase your exercise, and then usually by about 6 weeks after you can do just about anything in terms of activity. And it gives really nice results. It makes people look much younger, and if those are sort of the things that concern you, then that's a really good way to do it. Many people, along with the facelift, will consider doing some work around the eyes, or the so-called blepharoplasty, and they go together very nicely because the blepharoplasty addresses more like the appearance of the eyes, and we can just talk about that a little bit later.